Hey, everybody. Welcome back to the Outcomes Rocket. I'm so excited to have an amazing friend and an excellent healthcare leader, Dr. Gregory Goodman, on the podcast. He is a medical director at Maribel Health, an associate physician at Brigham and Women's Home Hospital program, and instructor in medicine at Harvard Medical School. He's a recognized physician leader in hospital at home and has performed hundreds of home hospitalizations. Dr. Goodman was awarded the 2022 Hospital at Home Physician of the Year by the Hospital at Home Users Group. His clinical focus is on building innovative home-based care models, and I'm so pumped to have him here on the podcast. Greg, welcome to the Outcomes Rocket.
Saul, absolute pleasure. Thrilled and honored to be on your show, and thank you so much for having me.
It's my pleasure. And I just got to say for the listeners and to you, Greg, kudos, because back in the early 2000s when I was deciding to kick off the podcast, I went to your website. And for those that don't know, Dr. Goodman has a podcast as well. And I was just like, man, who is this Dr. Goodman? Like, you had all these awesome people on there, and I actually aspired to be like Greg and his podcast. So you were an early inspiration for me, and I'm excited that we're here chatting about the very amazing work at Maribel. So Greg, before we start, just tell us about what got you into the business of healthcare, and we want to know more about that.
Saul, thank you so much. Since I was pretty young, I think in elementary school, I wanted to be a doctor. So, in high school, I was shadowing a neurosurgeon, during the summers. I do anything but neurosurgery now. I'm a general internist.
Nice.
But it was the early exposures to healthcare, serving people, seeing the value of being able to, be a part of somebody's life in a really unique way. And so, right after med school, I had the opportunity to join a venture-backed startup called Remedy Partners, thinking about new payment models with bundle payments. I then went back and finished my training at kind of a small community site, and then joined academic. So very different path in terms of my journey, and felt really fortunate as I was thinking about what I wanted to do with my life. I'd read David Levine's first randomized control study, sharing the incredible work with the first 20 patients in terms of hospital at home, and was just incredibly inspired by, the impact he was having. And for the last 6.5 years, have practiced at Mass General Brigham. I was the first full-time home hospital doc. So
that's awesome.
All in. And then, joined Maribel, which I'll share more about, where our mission is to make, home as the center of the healthcare system. And so personally, it's really, really meaningful. My grandfather was a house call doctor in South Africa and actually tragically passed away, making a house call at 34. And so to me, I get to share his legacy. Every day I make a house call. Every day I help a health system build care in the home. It's honoring him and his really incredible work. And, he was doing this 60 or 70 years ago. So we're getting back to the basics of just providing excellent care to patients and supporting big healthcare, systems to do that.
I love it, Greg. And when you first shared that story about your grandfather with me, we were in Boston together a couple months ago. I was like, it really touched my heart to hear that you're doing what you're doing in honor of him and getting back to the basics. And I think it really connects well with what you guys are up to at Maribel Health. So why don't you talk to us about what you're doing there and how you're adding value to the healthcare ecosystem?
Yeah, thank you. So Maribel Health was started by Dr. Adam Groff and Ron Paulus, so physician-led, and I was the first hire. And what I thought was unique about Maribel was that, Adam has a very deep home-based care, background, was kind of the former, chief medical officer of Bayada. Ron is a former CEO of a large healthcare, system Mission. And so what I thought was really unique about Maribel, where our mission is to make the home the center of the healthcare system, is that deep expertise across the, continuum, all the way from the very acute facility-based care, into the home, right, and into the community. And so our kind of goal is to provide expertise and tools to large, healthcare organizations. They could be healthcare systems, they could be home care agencies, and supporting them on that journey, right? Providing a partner, both knowledge and tools and technology to help them deliver home and community care. We spent a lot of time in the acute care space, supporting large organizations like Mercy to build, the first hospital at home in St. Louis. But we're also working with Bayada, which is one of our investor partners, in thinking about how do we design, care for the community, with a focus on palliative care. And so I think what's unique about Maribel is we're deep, in terms of being operators, being clinicians, being technologists, and we uniquely partner. So it's not a one size solution fits all, but really figuring out how do we add value? Where are you in that advanced care journey? And how do we support you in your community to get care at home?
I think that's great. And there's a lot of clamor around this topic and how do we make it happen? And the entrance of large consumer companies making a play at also doing this type of work. How is what you guys do at Maribel different or unique compared to what's out there?
Yeah. I think what's most, unique is kind of the way in which we form our partnerships. So because we have deep experience in, large health systems, because we have experience in home-based care, organizations, most of our team or many of our team are clinicians. So I think we're rooted in that unique perspective of actually knowing how to deliver the care. And it's really hard, right? It's not, let's set up a kind of a program and let's get going. It's, designing a model, understanding your population, understanding your community, doing that deep analysis and figuring out what is the best strategy to get going. And I think that's what we're different about. We're not, just a purely, venture-backed tech company that's trying to, that has a single RPM solution. We really think about how do we connect expert knowledge and tools to, appropriately build, capacity, for your hospital, as well as, serve your community. And so I think we partner with our health systems and home care agencies in a way that's sustainable over time. We want to build, many year and potentially decade relationships. And so it's really thoughtful, intentional with how we partner and, the effort that we put in on the ground and to make sure that it's a success for the health system, for the home care agency, and for the patient, most importantly, right? Providing an absolutely exceptional, experience and thinking outside the box to do that.
I love that, Greg. And what does a win look like? You get one of these programs into place. Is it uniform? Does every organization think about this differently? Share more about that.
Yeah. So maybe I'll give you an example, right, of a program I've been intimately involved with. So Mercy is a large healthcare, organization with their headquarters based in St. Louis. At the their kind of corporate layers called a ministry. At their ministry layer, they made a bold move in terms of their 2025 strategy to say home is the default site of care, which is incredibly bold, right, from a senior leadership perspective.
Oh yeah.
And so then we worked backwards and said, okay, how can we support you on that journey? Hospital at home, from a capacity, perspective, their hospitals are overfilled, the EDs are congested. So that seemed to be a significant problem that, we could support them on. And so we spent time, about 9 months, designing the program hand in hand, right? So our kind of executive team with their team in the trenches, thinking about how do we design a model that's sustainable, scalable, that serves their community, not only in the St. Louis market, but also, throughout their ministry. And so we launched our first hospital at home program in late September of last year. We spent a lot of time, right? It's a whole new model of care, educating, providing knowledge transfer, building systems, helping to build the capabilities to do this. We're very excited with where we are. We're, already in the top 2% of, hospitals in terms of volume,
Fantastic.
in terms of hospital at home. And we're expanding to sites. And so I think our keys to success are, partnering and understanding the organization, building those relationships. It's back to the basics. And then making sure that we ensure that the care is absolutely exceptional, for the patients, and supporting the clinicians on this new journey, right? Being a home hospitalist is very different, right? It's not something that you're trained to do during your, traditional internal medicine training. And so how do you gain those skills to support, this new model of care as a leader in the space?
That's fascinating. Appreciate that example. Really brought it home for me, and I know probably for the audience too, Dr. Goodman. So as people are thinking about doing this, health system leaders are considering it, or maybe they tried and got burned. What's one of those biggest setbacks that you see out there? And maybe give us a framework that we could think about it in.
Yeah. I think the hardest thing is that, for a lot of health systems, they have a number of priorities, right? Because they're thinking about, right, their system in general. The focus has mainly been on bricks and mortar and facility care. And so I think as a lot of healthcare system leaders think about it, a partner is a great option, right? Because our team wakes up, sleeps, breathes, and thinks about how do we advance care in the home, which is very unique and different. How do you mobilize a workforce? How do you support, the current technologies? How do you engineer those solutions to support each of those kind of components? And so I think, our approach, right, is to do kind of an assessment, right, kind of more of the strategic advisory services to understand where are you today? What's the current state? Where do you want to go? And then how do we fill in those gaps, right? And that's kind of our approach with each of these organizations. Everybody's got different goals. Our goal is to partner with organizations to support them on building, a sustainable solution, for them and their system. So we want to be a long-term partner. I really can't stress that's like a huge differentiator. I fly out to St. Louis, probably twice a month and train and coach our physicians and providers. It's a full commitment. We're all in on supporting them. It's not provide strategic guidance, support them on implementation and good luck with the customer success. Yeah. We are all in terms of that, support framework.
That's awesome. Well, that expertise is key. You guys have it. The partnership is critical. What about technology? What role does technology have here in making all this happen?
Yeah, I think technology is absolutely critical. The way I like to think about our company is we're, a team of experts and consultants with a world-class engineering team.
Nice.
And so the way we're thinking about technology is how do we, fill in the gaps for what exists today? So a lot of systems use Epic. So how do we leverage Epic to its greatest, capabilities? How do we build, right, the kind of the framework within Epic to support clinical documentation? But, Epic was built as an EMR for a lot of facilities, right? Not kind of, a mobile, workforce platform. And so I think what we're thinking about is how do we make clinicians, more efficient and optimize workflows and kind of hardwire technology. And so our technology platform over time is going to be modular. So plug and play, maybe you have an RPM solution that you want to use. You have an EMR. What are those gaps, right? It could be logistics. It could be workforce management. It could be visit planning. So, our platform is designed to kind of support you and, help you in terms of thinking, geographically, right? Because you have a nurse here, you have a paramedic here, you have a doctor here. How do we deliver the right care at the right time at the right location, utilizing those resources in a way that's most efficient? And so we've been really intentional with not, just coming out with a platform. We're co-building and co-designing our platform, with Mercy, as well as thinking about how do we, support many of our partners, in terms of, using tech to scale these models.
That's great, Greg. And we all know we don't need another point solution. So I think it's great to hear about the intentionality that you guys are taking with the technology piece for sure. So very excited to hear about the model, the way you guys work. For everybody listening, thinking about a program like this, or just wanting to learn more and getting ahead of the game, what closing thought would you leave us with? And what's the best place that the listeners could get in touch with you and the Maribel team?
So in terms of closing thoughts, go big and go home. We need bold healthcare leaders that want to make a difference.
I like that.
From a patient perspective, it's incredibly meaningful to sit on their couch, meet their pets, do a kitchen walkthrough. That's the secret sauce to this model, whether it's on the acute care side, or providing longitudinal care to patients and families. It's that deep bonding connection. It's what is most meaningful, I think, and the reason why I continue to do what I do and I'm so passionate about it. It's incredible, right? Once you've made a house call and kind of had that, honor of being a guest in somebody's home, there's just so much we can do. In terms of connecting, would be thrilled and happy to have conversations with healthcare leaders about where they are in the journey and, how Maribel can support. You can reach out on LinkedIn or directly through the website. Or via email. And Saul, super honored, to be a guest on your show. I look up to you and what you've built over the years, and it's just fun to watch. And the work that you're doing is incredible to support, healthcare to advance and make sure that others get to hear about what's out there, so they can make great decisions and support patients. It's really exciting.
Yeah, no, thank you, Greg. Really appreciate that. And kudos to you and the work that the Maribel team are up to. I can't thank you enough for being with us. Folks, in the show notes, you're going to find all the ways to get in touch with Dr. Goodman and the Maribel team. So don't shy away from that. Go big and go home. I love that call to action that Greg left us with. And with that, just a big thanks to you, Dr. Goodman, for being with us.
Thanks, Saul.